And welcome to our final surgery for today. Our patient is here from Texas? Texas. He is having back pain in the thoracic. Just lay still.
You're doing great.
And that said, he has a herniation at T8-9 that we're going to go in and try to fix today. You can see from his x-rays he's had lots of stimulators and other kinds of surgery done. Let me just get focused here. 12, 11, 10, 9, 8. Okay. Just lay still. Everything's okay. Shot. All right, let's go ahead and count some ribs. Give me an AP. So to do thoracic spine surgery, you have to find a reference point that's reliable. And there's two reference points that are potential, or three. There's the ribs. All right, we got 12, 11, 10, 9, 8. So far, we're off to a good start, right? Let's go back to a lateral. It looks like we're heading towards the proper location. Num. So we want to be at 8, 9. You okay? Our patient is going to be awake for the beginning of the surgery. Lung fields look good. All right, Jordan, I need to see something there. You need to move further north, I think. All right. What do you think? I think we're probably a little higher than we want to be, right? You think? I think we need to be here. Let's try this. Shot. Okay. It looks pretty good. You okay? Shot. Oh. We want to line up nicely with the disc. Shot. Is he okay? Yeah. Excellent. Shot. All right. Let's go see where we are to make sure we're at the right level. I think you're off a little bit on orbit. What do you think about that? Looks like a double facet, doesn't it? Yeah. Let's try to fix that. So our patient's gone through a lot. All right, let's count. 12, 11, 10, 9, 8. That's 8, 9, right? Everyone agree? I agree. That looks good. Let's go back to a lateral. You can see the wires in his spine, folks. Those are wires from a spinal cord stimulator. These doctors have had a field day with him. Instead of sending him to Duke Spine to get fixed, they're just putting all kinds of metal and implants and wires in them. Of course, none of that shit works. That's why we don't do it. All right. I think we're almost there. Let's see if we can reorbit it a little bit. What do you think, Jordan? Huh? I'm gonna try going the other way, see try it. Yeah. That's, I think, better, right? you fell into the trap, the Mo Betta trap. Mo Betta. Mo Betta. Huh? All right. I think that's probably about as good as we're going to get it. You agree? All right, let's see if I can't make this work. Shot? Where do you feel that?
Where do you feel that, my friend? In the middle
All
of the
right.
back.
Good. Just lay still. Everything's fine, I promise.
You're doing great.
Okay?
Really
You're going to have a little discomfort until we get to where we need to go. Shot? Shot. Shot. so close. Shot. Just a millimeter away from where we want to be. That's it? Yeah. Shot? It's not quite. AP, let's try an AP. Let's just verify one more time. All right, 12, 11, 10, 9, 8. Everyone agree? 8, 9. All right, back to a lateral. We're very close on the approach. I may need to just start a little wider or make it a little steeper. You all right? All right. I'm sorry it's a little uncomfortable. You're doing great. Well, we got lucky. All right. You can see we're right at the back of the disc. This is your bad disc, all right? You feel it, huh? All right. Is that better now? Let's get an AP. I say lumbar. I don't know, Luis. Lumbar? What do you think, Luis? Lumbar? Lumbar? Okay, that's great. Okay, so let's just check those ribs one more time. 12, 11, 10, 9, 8. Everyone agree this is 8, 9? I think it is. How long have you had your back pain? It's pretty crazy that I'm talking to a patient while I'm doing spine surgery, isn't it? How long have you had it?
23 years.
Thoracic pain, 23 years. Right in here, right? Yes? How come nobody else fixed you? They didn't know how it was right. You came to the place that can fix you, the one place in the world, basically. Are you having any pain? Have you watched these surgeries? Huh?
Yes, he has.
You know what happens next, right? All right, I'm sorry.
Okay, just gonna hold you a little bit here, bud.
How bad is that on a scale of 1 to 10? How? 10? Is that where you typically get your pain? All right, my friend, we found it. You're a very strong, brave man. You're going to be rewarded. When you wake up, that pain will be gone, okay? Just count. Yeah, go nice and slow. Count from 1 to 100 out loud so we can all hear you. You got to count in Chinese. Just kidding. Just giving you a little more numbing medicine, that's all. That's what you're feeling back here. I'm sorry. All right. So, great news, folks. This is honestly so wonderful. I mean, just take a moment to think about this. It's kind of like watching your first sunset. Here's a patient who suffered for 23 years with a disc injury that's been causing his pain right here. And he's had all these surgeries done. Look at those wires in his spine. Horrible. Spinal cord stimulator, pumps. He has been searching for an answer and finally came across our website. And God has answered his prayers. He came to the one place that does thoracic disc repair. Duke Laser Disc Repair, thoracic.
Okay,
All right. And now we're going to get rid of that pain that he's had for 23 years in the next 20 minutes. Thanks to our team here at Duke Spine. Now, I never used to do these thoracic cases. Is he awake? Huh? I never used to do these thoracic cases. I always thought they were just too risky. And I had basically patients who told me that if I didn't do it, if I didn't fix their thoracic pain, they literally were going to kill themselves. And those patients were my inspiration. All right, got the guide wire in. And they made me do this procedure for the first time. It was about 3 years ago. If you go to our YouTube channel, you can see the very first patient. He's very dear to me. Can't tell you his name. Shot. But when we did his surgery, he woke up, he had no more pain. And he was so happy. I mean, he was crying. And hell, I almost cried. I think I did cry. But that said, it was an incredible experience for not just the patient, but for me to know that I could help people get out of pain, people that have this condition, thoracic disc herniation. All right, well, we can use either the cervical or thoracic, lumbar thoracic system. And I like this system because it gives us a little more room. He's got a lot of inflammation in that disc. You can see it on the MRI. It's right where the dye is right now. It's a white area. All right, I'm going to give some more numbing medicine. He's a stoic guy, meaning he takes pain quite well. He is not a sissy, that is for sure. So, shot. We're heading down to the back of the disc, the T8-T9. Shot. Let's get a quick AP. Huh? I got it. Shot. Good, good, beautiful. See the lung fields look good? Here we go. We're actually entering the disc through the foramen, called the neural foramen. And the neural foramen is where nerves come out. Now this guide wire is guiding my tool. Is that it? Huh? That is current, sir, yes. All right. Can't really give him any numbing here. Just give you a minute. We're going to get him a little deeper, let him be a little more comfortable. Is he on the CPAP? So I really feel good about this, that we're going to be able to help him get rid of his pain here. His pain, like he literally put his finger exactly there where the T8-T9 disc is. He's got a herniation there, and he's definitely got inflammation going on. You can see the inflammation on the MRI. And I knew that when I saw that one disc with the inflammation, and I did an x-ray and lined up where his pain was, he needs a little bit more. His pain was quite literally, take this, right where his thing was, shot? Right where his herniation was. Shot. All right. We're now inside the disc. get rid of that guide wire, okay? You have gloves?
Sam, got gloves?
Should have gloves on. Gloves on. Sharps container. All right. He's not liking it, but yeah. Excuse me.
Oh. I don't want to stay in line.
Okay. I know it looks barbaric, folks. Believe me, I do. But the truth is that this somehow works. And it really works quite well, actually. I don't have any pressure on my irrigation. Come on, guys. A couple of things we need to get right. One of them is the irrigation. Luis,
Yes, sir.
you need to help her. Okay, that's better. All right. So we are inside that damaged disc, and wow, look at the pink tissue there. That is probably granulation tissue.
Do you mind to turn off the light, please? Thank you.
This is disc material. We tried to stain it blue, but it didn't stain very well because there's so much scar tissue here inside this disc from all the inflammation for all those years that he's been suffering. It's just a little bit blurry. All right.
Your light up a little bit?
Huh?
Your light?
My light? No, it's a little bit of blood in the water, in the irrigation, that's all. This is the herniation. Look how scarred up it is, folks. This is not a normal disc. This is a disc that has undergone inflammation for 23 years, causing pain. This poor man has driven this poor man to do all kinds of things like get stimulators, wires put in his spine, just craziness. Pumps, intrathecal pumps. I'm hoping, God willing, we're going to get rid of that pain today. And then he can get all this junk out. Come on. Yeah, he's responding a little bit. This is a sensitive area for him.
Slow deep press, my friend.
We have a question from Casey Carpenter on Facebook.
Yes.
Is that the conscious sedation that is being used,
Yes.
and that's why he can talk?
He's conscious sedation is being used. This is not general anesthesia. He is being under conscious sedation because we need him awake to help me do the surgery in the beginning. I need him to talk to me and to know that our entry to the disc is in a safe path, and the only way to know that is to get feedback from the patient. You want me to wait? So he has a mask on his face that we're using to help ventilate, give him enough oxygen. You need help up there? Or you good? Wow, a lot of scar tissue. This whole disc has almost completely been replaced by scar tissue, and still he has the same pain that he's had for years. Guys, how we doing over there? We really need that irrigation working. It seems to be okay right now. What are you experiencing over there?
One pump is just failing on me. I might use a pressure wagon in a minute.
We can do the most advanced spine surgery in the world, but having a pump that actually does its job is too much to ask for. How's he doing? All right. Look at all that scar tissue from chronic inflammation.
About 10 minutes?
5 minutes.
Please, 4x4, not seam. Please, I'm trying for it.
Staple.
Same. Yeah. So Bossi, 4x4, and Frankfurt.
Let's go grabber. So we're literally between the vertebral bodies here. And you can see the end plate bleeding. You can see the pieces of herniation here that I'm pulling out. They're very scarred up. But they're coming out. I'm really hoping this patient does well. We did a study on thoracic Duke laser disc repairs. Turns out of the patients we've done, the average pain relief of the thoracic disc pain was 99%. Right. Come on, Oscar. When they're asked about their preoperative pain, how much did we get rid of? The average is 99%. That's why we do the surgery. The results have been really good. Grab her. How are we doing over there, guys, with the irrigation? You got what? All right.
We have a question from Casey Carpenter.
From who?
Casey Carpenter on Facebook.
Yeah, it's open on our end. Yeah, okay.
What medications are being used for the conscious sedation in this case?
It's propofol. Propofol is the best you can use. That's what we use, propofol. Of course, we have an anesthesiologist here administering it. This is not surgeon-directed conscious sedation. This is anesthesiologist-directed. Our anesthesiologist is here, and he's monitoring our patient and managing the propofol sedation. And he says everything's going well. Anything else we can do on the irrigation side? Huh? Let me just see what we're getting here. Because, well, it's actually good. I guess it's just a lot of inflammatory tissue. Not much I can do about that. Except to remove it. Yeah, he's not liking that. A lot of bone spur here. Doing all right? Just about done. Probably 3 more minutes, maybe 5 minutes max. This is the most painful area for him. Look at that calcified disc. The whole disc herniation is not calcified, just a little bit. Little bit of bone spurring here. Almost done. About 2 more minutes. Berndes, grab her. 2 minutes. This is the back of his disc right here. Look at all that calcium. All that's from just chronic inflammation, chronic pain and suffering. That's what happens to these herniations over time. They get calcified. Just about done here. I'm almost out. Communicating with my anesthesiologist so that he knows. That's the back of the disc right there. That's pretty cool. 1 minute. That's the epidural space right there. You guys see it? 12
Yes, we
o'clock.
do.
All right, we're done.
Lights on, please. Thank you. Profile. Thank you.
Little antiseptic there. Irrigation. Pretty good. I don't anticipate any issues. He's done real well. And we're done. I'll hold it. So I'm just going to put a little pressure here on the incision. Any questions from the audience?
No question.
So we're just going to wake him up and we're going to put a little staple and a bandage here. You guys see all of that was done through a 7mm incision. I like to put pressure for about 2 or 3 minutes. Hold on. Just keep some pressure. Are you ready? You got this? All right, good work everyone today. Great job. Any other questions from the audience? Thank you.
No questions.
Great job everyone. High fives all around. I think he's going to do great, hopefully. I didn't see any problems. Ventilating good?
Oh yeah. CPAP.
Awesome. Lungs are good. You got breath sounds, both sides. Let's make sure. All right, you can go ahead and end the broadcast. We'll see you guys next week.
Copy that. Ending broadcast in 3, 2,